Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Hello, I'm your host, Gretchen Badami, and today we're here with Dr. Robert Chu. Dr. Chu is a licensed acupuncturist and herbalist renowned for his expertise in Master Tung acupuncture methods. He lectures internationally, sharing his knowledge through the International Tung's Acupuncture Research Association, called ITARA, which he founded in 2005. Dr. Chu has been a clinical supervisor at the Disney Family Cancer Center in Burbank, California. He teaches students in the doctoral program at Emperor's College, and he maintains a private practice in Los Angeles, California. Dr. Chu provides CEU courses for acupuncturists and a variety of medical professionals, and is the author of at least 10 books that I know of. There may be more. I'll have to ask you about that. Additionally, Dr. Chu is a renowned Chinese martial artist. He is a second-generation disciple of Ip Man and has studied with Master Hawkins Chung and Kwanjong Yun. Dr. Chu has dedicated his life to the ancient Chinese ideal of balancing scholarly and martial achievements. Welcome, Dr. Chu.
Thank you so much, Gretchen. Thank you for having me.
Thank you for being here today. I am so excited to ask you so many questions. First, about your history within this medicine and what brought you here and your personal trajectory. And then to hear about your teaching and personal study and your practice of the Master Tung acupuncture system and how you use it within your practice in combination with herbs and treatments and how this practice works for you. So I just want to get right into asking you questions, if you don't mind.
Please do.
I would love to hear about your history. What brought you to this medicine, either having used it as a child or learning about it? How did you find it and decide to make it your life's work?
Well, being a child of immigrants, first generation from Hong Kong, I would say that medicine has always been a part of our culture. And as a result of it, it's always fascinating to see, hearing about manual manipulations, 推拿, using herbal medicine at home by taking it, drinking it, decocting it, or using it topically. There's also, stories about sticking needles into people when I was a kid. And it's like, what? You can get a result from that? People can heal from that? And, of course, Chinese parents always admonish you, don't walk around barefoot, put on some clothes, to keep yourself warm. Keep away from drafts, wear a hat when you go out, things like that is always the case. Or, we have the dreaded huo qi, or Cantonese call it yit hei, the fire in the mouth, sores and things like that. You're eating, this is too cold or that is too hot. You should not eat that according to the seasons, and other strange things to, a boy who's growing up in America, and you're hearing things. And of course, you bring things to school and you have the, ew, what the heck is that moment with your lunch? And you're eating things that are different than mainstream. But on the other hand, you're growing up. So I think myself growing up as a bridge between two cultures naturally drew me to want to study, of course, the martial arts to protect myself and for the culture. And then part of the martial arts tradition is, of course, we know 推拿comes from martial arts. And we know that topical herbal medicine, or what we call fall and strike medicine, 跌打, it is part of martial arts as well. So always when I was practicing and training, one of the things that I noticed was I always get hurt or bruises, and then I put on this brown liniment, and lo and behold, the bruises disappear in a little bit, or if the muscles get pulled, maybe the master is using some kind of cupping, which is amazing, or some manipulations just to pull things back into place. And it's like, wow, you're amazed by all of this. And then the secret arts are, if you hit a certain point, you'll have this effect. You can immediately knock someone out or paralyze them or cause them to stop breathing and other fun things like that. It's part of the lore studying the martial arts. And so you always hear about it. And I think many of the movies probably show and demonstrate this aspect as well.
You found yourself as a young boy wanting to be that martial artist. Let me ask, what specific type of martial arts? I know the answer to this, but our listeners may not know. Do you currently practice, and why did you end up gravitating towards that type of martial arts?
Okay. I still practice daily. And they say that hot water never gets cold if you keep the heat on it. So that's one of the precepts that I grew up with. And so you have to train all the time. And if not one thing, then you do something else. For example, I might do some seated meditation and then go through various forms. Or in the clinic, in between patients, I might do Tai Chi. Or I'll be training with weights or kettlebells or traditional martial arts weights like the stone lock, or different types of levers and strange things that people wouldn't know. Or I'll carry bricks and grab them and hold them and walk throughout the clinic with them and things like that. And then I have various weapons in every nook and cranny of the clinic, which is a lot of fun because okay, I want to practice the pole form, so I'll grab a pole and then do it in the clinic when no one's around, or sword forms or things like that. So there's always something to do, always something to train. Crazy people do crazy things, so I'm one of those.
I have read some articles. You've been featured in a number of martial arts magazines as well, both here and in China, and you have a mastery with what is it called?
It's called Wing Chun. Yeah, I think that's
Wing Chun, and then within that, then there is also there's a stick, and then there are knives. There are different implements that you use as well.
That's true. I primarily teach Wing Chun, and it's been a large focus of my life for a long time. As you mentioned, I am a second generation disciple of Yip Man. You probably see the different movies. That's an aspect of who my grand teacher was in Hong Kong when he left because of the Japanese and CCP takeover of China, and then he went to Hong Kong to escape. And he brought his system, which features a long pole and knives and empty hand. And one of the most famous students is Bruce Lee. Well, Bruce Lee was an actual character, and he got kicked out of school for fighting in school. And my teacher saw the new kid in his class and said, "Hey, what are you doing here?" He goes, "Well, I got kicked out of my other school." And he said, "So you must be a big troublemaker, And they became friends, lifelong friends. And they found out later that they each studied with Grandmaster Yip Man.
Oh my gosh.
It was a lot of fun. So my teacher's name is Hawkins Chung. He passed away a few years ago. Just at the beginning of the COVID. We had many, many discussions over the decades with him. I spent over 3 decades studying with him. And he always told me about his fondness for Bruce Lee, how they were like competitors, and they shared information with each other. And it's quite lively. The innovations and the martial arts training, the realistic, the usage, the challenges and fights that they got into. It could make a good movie or a good book. I was entertained for years with my teacher's stories. But overall, when you learn martial arts, the end goal, I think, is peace. In fact, martial arts is supposedly to stop conflict. And so because you learn so much, you don't want to have conflict and you want to go for harmony. And we have a saying that when you learn martial arts, we say, 传有心法. That means the fist must come from the heart. And in Chinese, we talk about the heart. That means you put effort into what you do. You have heart. It's the same as in English. This person has heart or has a good heart. In Chinese, we mean the xin and the yi. Xin is the heart, of course, right, where the Shen exists, the heart, the spirit, and Yi is the intellect, but it's also the intention and the idea. So if you have the intention and idea and heart behind the intention and idea, then one thing can be 10,000 things. And then we also talk about Confucius had a saying, if you have heart, then you have compassion or benevolence. And if there's no heart, that means you put no efforts into what you do, then you have no benevolence and no compassion. Mm. And this is one of the heaviest teachings in life, because if we know that our Chinese medicine, we have a saying called Xin Ren Yi, means a benevolent heart or compassionate heart leads to compassionate medicine. And you see these 4 statements that I said about fist comes from the heart, or the boxing method comes from the heart. That means your teacher must love you in order to really teach you the boxing method. And then Confucius' ideal that if you have heart, then you have compassion. But if you have no heart, i.e. no efforts, then you have no building of benevolence or no expression of compassion. And then finally, our medicine is supposed to have this kernel, ren, kernel like seed, like tall ren, right? Ren is to have benevolence or compassion. Ren xin in your heart, benevolence in your heart, and then you have a benevolent medicine, or compassionate in your heart, you have a compassionate medicine. And so those 4 sentences I really try to stick by and understand, because whenever I do things like I teach, I give it my best. Whenever I share with people, I give it my best. When I treat patients, I give it my best. And so I think that's the thing. Recently, there's a discussion about the imaging systems. For example, you have ear imaging, you have scalp imaging, you have nose imaging, hand imaging, face imaging, etc. And then it's like, well, another system came out, and they have imaging from the sternum down to the belly button. And so people were discussing it. How could it be? The way we keep looking at different images, how could it be? And I said, well, let's look at it from this point of view. If you're looking at images, it's the intent behind looking at it. So we have an old saying that intent guides the qi, and qi guides the blood. And we know in modern days that if that's the case, then the healing can take forth, because all medicine in Chinese medicine is really, I have to have qi and blood move. And that's how we heal, and that's how we get nutrition. And there must be intent, again, to send it towards that area. So when it comes to, let's say, a new type of imaging or another type of imaging, then we say, okay, well, let's say this sternal notch is the top of my head, and so on and so forth. If it goes all the way down to the xiphoid process or the umbilicus, then that could be my lower abdomen or Huiyin area, right? So from top to bottom in a meditative position, right? Seated meditation. So we could use that as an image.
And the things you're starting to mention are moving us into me wanting to ask you about your practice of acupuncture and the Master Tung system. But before we do, I would be remiss to not mention that I've had the good fortune to know you now for at least 15 years, getting closer to 20 years, and also to be your student as I went through the schooling of learning this medicine. And still to this day, I'm always learning from you. And I just wanted to say that these notions that you've learned through your daily practice with the martial arts leading you to this medicine, not only are they the foundations for how a practitioner should be viewing the world and underlying philosophical tenets for a practitioner to understand, but they do shape your being. And I know you for so long, and I can see how this has entirely shaped your being, your countenance with the patients, your understanding of the medicine, and your overall composure throughout life. It's just, it's a real testament to the idea that not only do we learn the intellectual information when we practice this medicine, but we have to cultivate our own spirit, our own Shen. And as you're saying, bring the heart into it as well in order to be successful doctors.
Correct. Yeah. Without this mind, body, spirit, and emotions integration, then we're not a complete being. We should learn more about acupuncture from the classics. We should understand how the ancients looked at the health and the human body. It's not departmentalized like we have it today, right? The physical has to be attended to. The mental has to be attended to. The emotional has to be attended to. The spiritual has to be attended to. For example, I also studied Ayurveda, and my teacher was a student of Vasant Lad. And Vasant Lad, he made one statement that struck me. He said, when you look at disease, the problems with disease all comes from Vata, Pitta, Kapha. And we look at those and say, hey, well, what does that really mean? Well, Vata is emptiness or air running to the void. So that's wind. Okay. Pitta is fire and water. And then there's earth, Kapha, which is earth and water. So it's accumulation. But if we look at him from the spiritual aspect of medicine, Kapha is accumulation or greed. Pitta is fire or anger. And Vata is as movement from ignorance. The causes of disease are exactly the same as in Buddhist teaching: greed, anger, stupidity, or we come down to it. And so it's like, wow, spiritually, who knew it was that heavy, right? And a lot of the diseases that we treat in Chinese medicine, of course, they deal with inflammation, which is fire. We deal with accumulation, phlegm accumulation, or stagnation. And then we also deal with wind, internal wind or external wind, right? Yeah. So you come down to it, it's like, the ancients, they had this connection to the universe and to life, and it was totally different than how we aspect it today. Nowadays we get, well, what are good points to treat this? The people are looking at it from a cookbook approach, but they're not thinking of it from a holistic point of view.
And bringing in the holistic aspect with all of the emotions and the root of the disease based in emotions or habits or trauma, or we could do an entire another podcast on this, right here.
Yeah, I think so, definitely.
I'll be reaching out to you again in another 6 months for part 2, where we go deeper. So with all of this as your background, it sounds like you studied the martial arts, you studied the herbal topicals for injuries and for healing the body, you studied the mind-body medicine, and then this coupled with your background growing up of having aspects of the medicine and the food and the diet and the culture, it all wove itself together to bring you to want to practice this medicine as an adult and to study it and to make it your life's work. When during that course did you end up discovering the Master Tung system, and how through that did you determine that this was what you wanted to focus on?
Very, very good. Thank you. When I was a student at Samra University, during that time, met many professors from China. When I would go to clinic and hang out with the fellow students there, we would speak to each other in Mandarin or Cantonese, and it was a lot of fun because we would have lunch or share meals or share snacks and things. And then one day I was seeing a fellow classmate reading this book, and she was reading it on Dong's Acupuncture. It's written by my teacher, Dr. Yang Weijie. And I said, what is this? She says, well, this style of acupuncture has an additional 700 points to it, and it's based on something different, and actually it's probably older than TCM. I go, what? So at that time I thought TCM was something super old, from the time of Huangdi and the Yellow Emperor and stuff like that. But the reality is, if we look at it, modern TCM is a phenomenon that occurred after 1949. Okay, now Master Tung, he went to Taiwan in 1949 because he was part of the Republic of China. And because China was involved in a civil war as well as invasion of the Japanese to China, the Nationalist Party, or the ROC, lost. And after the Japanese surrendered in 1945, China was still embroiled for 4 more years of civil war. And finally, the CCP won, and the ROC was allowed to retreat to Taiwan and go there. And Master Tung was a soldier in the ROC army. And because of that, he preserved his system of acupuncture in Taiwan as opposed to China. Now, how did he learn it? Supposedly, the Dong family was a generation after generation of doctors. How long? I don't know. Okay, but at least his father taught him in the clinic. And from age 6 to 16, he stayed by his father's side in the clinic. I guess it's because there was no iPads or iPods or iPhones.
Nothing else to do.
Yeah, nothing else to do. You might as well watch Dad treat some patients. Probably Dad taught him the Chinese style. This point is Sima, and this is Xia San Huang, and this is Shen Guan, and this is Ling Gu Da Bai. And, told him to pay attention, and then he would remember everything. And when he left with Taiwan, he had the complete memory. And while he was in the army, he treated so many patients over there, about a quarter of the patients, no fee. And they loved him. They said, wow, your healing technique, he could get a miraculous effect with just a few needles. And he said, well, when he goes to Taiwan, he's going to practice the acupuncture. Now, meanwhile, during the mainland, 1949, they closed China to the rest of the world, the quote unquote bamboo curtain. And then they started to develop reforms of old China, the way things were. They wanted Western medicine, but Mao couldn't afford Western medicine. So he said, we have to bring back Chinese medicine. It's a great treasure in a storehouse. And actually, it's because they were bankrupt at that time. They had no money, so they needed a new healthcare system. And the new healthcare system was the old healthcare system, Chinese medicine. But it was largely herbal-based medicine. And then the acupuncture was developed by committee. So if we look at it, TCM is not as old as people think. The roots of TCM, of course, the classical Chinese medicine, that is acupuncture from the classics. And I would say the classics probably end at the Qing dynasty. And then during the Republic era, there was some reform of it. But, had not been for, we would not have Chinese medicine today. Sun Yat-sen, the president of the Republic of China, he was a Western doctor. He didn't have any thought of Chinese medicine at all. He would have abolished it under his rule if he did. Unfortunately, he passed away. The Song sisters, who were very influential, they were Chinese Americans, and they made their fortune in America from their father, who sold Bibles that were printed in China and sold all over America. And so they were very rich, the Song family, and they were married to Sun Yat-sen and to Chiang Kai-shek, the presidents of Taiwan at that time. And so the Song sisters had an acupuncturist that happened to be Master Tung.
Oh my gosh.
One day, the president of Taiwan says, I got a neck pain or I got a back pain. Let's go see my acupuncturist. And that was Master Tung. And so I told you about Master Tung's miraculous effect with just a few needles, distal needles.
Yeah.
Okay. And it showed, wow, I've got to learn. This was a fascinating system. I have to learn it, because it's like, what? You mean when people have neck pain, I don't have to stick needles in their neck? Or when people have pain in the lower back and buttocks, I don't have to stick needles in their butt or their lower back? Well, lucky me, because I had PTSD from, just people disrobing, and I had to needle locally. So I preferred to needle distally. But if we look at it, Master Tung's acupuncture is largely distal. But it's not to say that they don't do any local treatments. When we do local, we tend to prick or bloodlet, all right, and squeeze out a few drops and then move things that way. But if we do needling, we typically needle distally and get the involvement of the patient. Could you move your neck for me? I stick needle into, let's say, GB39 area or UB60 area, UB58 area. I ask the patient, can you move move your neck. And when they move their neck, they like have this shocked look like, what? How could it be? How is it that you're able to do all of this? Right?
So you've mentioned finding out about the Tung system and a little bit about the Tung family lineage and how he learned and how you first found out about this medicine. Aside from the extra points, there's 740 extra points and the idea of needling distally. What other aspects drew you to the system? I know that focusing on the channels and the collaterals, as opposed to the idea of Zong Fu and what we use in TCM, which is a reflection of herbal medicine's influence on acupuncture. I know that is one aspect that shows the difference between Master Tung and TCM. Can you explain that a little bit further for our listeners?
Yes, of course. So basically, Dong's acupuncture puts primary emphasis on the channels and the collaterals, and then what we call imaging methods. Okay, it can also be translated as correspondence, because it's also in Chinese it's called 对应. 对应 means it means to match or pair. Ying is like to correspond to. So in English, it's typically translated as imaging or correspondence method. Some people even call it mirroring method. I'm not sure that's always the best translation of it, but I think the insights of it really show you. I would have to say this, that acupuncture, your body is like the globe. And in fact, the ancients, they spoke about, the heavens and the earth is one great macrocosm, and then the human body is a microcosm. Okay, so there's a big taiji and a small taiji. The human body is a small taiji, and that's why the points are named as such, because they reminded the ancients of ditches or valleys or mountains or hills or mounds or other things like that. And they were talking about the correspondence to the heavens and the earth. And so one of the fantastic things about Dong's acupuncture is you could say that the channels are like the longitude. They go longitudinally on the body. And then the imaging is the latitude, the height. And so we can correspond anything using these different methods. For example, I'll take the most simplest one, is the hand imaging to the foot. So kind of like, probably when you're young, you probably thought that, well, the hand is like the foot, the wrist is like the ankle, the shin is like the forearm, the knee is like the elbow, the upper arm is like the thigh, and then the shoulders like the hip. And so I was telling you about my PTSD of needling patients. In TCM, you needle GB30. But in Dong system, you would needle Sanjiao 14 because of the correspondence. The shoulder corresponds to the hip or buttocks. Okay. Gallbladder channel corresponds to the Sanjiao channel. And without putting a 4 or 5 inch needle into the buttocks at GB30, I can put a 1.5 Chuan needle transversely into Sanjiao 14, and then ask the patient, could you, kind of move and squat even, because there's no needle in them. Mm-hmm. And if they get an effect, because usually what happens is, the muscle suddenly releases and relaxes. You don't have to needle locally. And that's the thing, is having movement. I have a patient who had frozen shoulder. Okay. So they're complaining it's along the trapezius. They can't move their arm a certain way. They have limited range of motion. So let's say they have a pain on the left side. I needle their right ankle, let's say by GB39 or GB40 area. I'll palpate and get a confirmation from them. Usually they have an Usher confirmation, right? That's it. I feel pain there. I feel sensitive there. I put the needle in. Then I ask them to move their shoulder. Whereas before they had limited range of motion. After inserting the needle, they have full range of motion. Who doesn't want to do medicine like that? Whereas if I did it the TCM way, okay, you got shoulder pain. I'm going to put all these needles along the usher points on your shoulder. And you can't move your arm for half hour, 40 minutes while you have the needles in. You can't tell what's going on. Whereas if I put one needle in your ankle and you move the local area, isn't that better?
You can get some instantaneous results.
Exactly. And so I get the feedback. So, when you do that, you feel great. It's like, wow, my medicine works. I feel fantastic. Why wouldn't I want to do that?
Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice, and quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode.
Right.
And the movement of the qi and the blood through the channel is important. So moving the injured or affected area is important to move through the qi and the blood at that time.
Exactly. And the fun thing is, this makes you think. You don't go through rote memorization anymore. Like, what is a good point for, neck and shoulder pain? Instead, you're thinking, okay, I can use this point to treat that. I can use this channel to treat that. I can use a related channel to treat that, and it just becomes more and more fascinating as you go by the day. It's an acupuncture system that does not rely on rote memorization, but rather logic and reasoning, critical thinking, and deduction, because you're able to figure out what the outcome will be if you choose a certain thing. And then there's always signs and signals along the way. Like I mentioned about the usher confirmation. Most people think usher point is, okay, I have a neck pain, so I stick the needle right in the neck, and that's the usher confirmation. But no, your body is a reflection. And so if I palpate your ankle and you have a strong reaction there, and I needle that and it releases your neck, well, isn't that better? And isn't that more fun? Because if we look at it, pain doctors, orthopedic doctors have to treat the neck directly. Chiropractors have to adjust the neck correctly. DOs have to treat the neck directly. PTs have to treat the neck directly. Massage therapists have to treat the neck directly, right? And so on and so forth. Everyone has to treat the neck directly, but I'm the only one treating the ankle. So isn't that a lot of fun?
Not only is it more fun for you, the practitioner, because you can't just phone it in. You have to be thinking about what correspondence you're going to use within the body. And way more fun for the patient because, my goodness, what you're doing must look like magic to them, because how the heck did needling a point on the ankle release the neck? No one will ever know.
Exactly. There was like a talk about how distal points don't work on a certain acupuncture forum. And I kind of thought to myself, well, maybe the practitioners here, they don't really know. So all they do is local. Well, what's the difference between us as acupuncturists versus those who are dry needlers, who the PT is moving in and encroaching on our territory right now? So are we using the same mechanism? No, I say not. We're not. So, I mean, acupuncture cannot be separated from the channels and the collaterals. And I would have to say probably from the imaging methods too.
Yeah.
Because when you have that combination, then you have a real point.
And now you had mentioned, as you started talking about points you would choose, you had mentioned choosing the opposite side. Is that always a given? Do you usually go to the opposite side, or how do you determine that?
That's a very good question. For pain purposes, we typically use the opposite side. And this is written in the Ling Shu and the Su Wen. In fact, the Su Wen, chapter 63, seemingly incorrect needling is telling you to needle the opposite side. And then in the Ling Shu, chapter 1 or 2, they're talking about using indirect needling. And that is talking about needling distally, right, away from the area. And there was a write-up in one of the old old classics, and they talked about a visit with an acupuncturist. And this one was very fascinating to me because you go to the acupuncturist, they would use a carefully selected point away from the affected area, and then there would suddenly be a release. And meanwhile, you're having a snappy repartee and conversation with the acupuncturist, engaging with the patient, and they're enjoying their time, and the acupuncturist is enjoying their time. And then, of course, when patients come to me, I give diet and lifestyle advice. I get emotional counseling. I do life coaching. I talk about, okay, don't eat this and that. Maybe if you want to deal with a certain problem, you deal with it a certain way. Those are the fun things. And, I love my job. I love my work because every day is an opportunity to help someone else. And, the mind is always engaged. The physical is not too physically strenuous. I have time to work out and train during the day, and it's a lot of fun. So
yeah. and it keeps you thinking throughout it. It sounds like with the determination of how to form these treatments. And speaking of that, so what I'd like to ask you, given that this is a podcast and unfortunately not a CEU, we can't, teach people very much in our interview, but I was wondering, are there any examples that you could think to give? I know that some of the main points, or two very often used points, Lingu and Dabai, are commonly used, at least in the system as the way you practice it, with perhaps a third point that is chosen based on what is going on with the body. Are there any examples that you could think of, either of a recent case that you've had or something that has worked really well, that you wouldn't mind sharing with our practitioners, so that if they're not familiar with the system or have never used it before, maybe they could have an example or two to perhaps try out in the future?
Yeah, thank you. Thank you, Gretchen. Yeah, for example, we use the two Master Tung's points as treating, and this is Lingu and Dabai. Lingu is just distal to the junction of the first and second metacarpal bones. It is more proximal than Li4. And Dabai is basically, it's okay, we could just say it for our purposes, Li3. So that is a combination of 2 points there. The hand is in the standing or vertical position, and then you needle directly perpendicular. Lingu goes first, then Dabai. That's why we use the mnemonic Lingu Dabai, not Dabai Lingu. Okay, that's another story. So let's say you have low back pain on the right side. So then I would use Lingu Dabai on the left side, and then needle UB40 on the right side, on the affected side. Now, UB40 is a fantastic point because it's the command point of the upper back and the lower back, right? UB40 is also very good for hemorrhoids, right? Although many people don't think of it as that. UB40 is also very good for kidney issues, okay? And so if we stick that in, it's opposite sides. So Lingu Dabai is like Tohong Su Wu Tang. It's a blood mover, a very strong blood mover, because the Yang Ming channel has the most qi and most blood. And because this is essentially the Shu stream point and the Yuan source point, okay, the properties of those, and then you're adhering and needling close to the bone, which affects the bones, then it's ideal to needle those points as treating points for the low back. Now, UB40 in this case would be like a guiding point. I'm guiding it to the area of the low back, and then I can ask the patient to shimmy or wiggle a little bit on the bed while they're lying face up, and then they'll get an excellent effect. We could also do the same thing. Let's say someone has neck pain. I can do Lingu Dabai, and I can do GB39 again, because GB39 from the classics is the best point for neck pain. And again, let's say the neck pain is on the right side, so I needle Lingu Dabai left side, and then on the right side, I put it in the ankle, GB39. I ask the patient to do extension, flexion of the head, rotation, lateral extension, and see what the situation will be. And usually, about 90% of the time, they get an immediate effect, and it's really surprising. And so I think every day you're amazed by medicine, because it's like, wow, I can't wait to try it again on some new case that I don't expect. And what would the outcome be? Because and if not, then I have to think things through, and that's also very exciting. Who doesn't like a job that you have to think things through?
And now, two immediate benefits that I can think of to this. First, I mean, you could even be doing this form of a treatment let's say, with them sitting in a chair, because
Correct.
needling, okay, lingu dabai is in their hand, UB40 is in the back of their popliteal fossa. They could be sitting and they could be moving around
Mhm.
as you do this. Same with, GB39. They could be moving their back, moving their neck. And then if you get immediate results, let's say in that 90% of the time, they feel significantly better. Do you then need them to sit there or lay there if they're laying for 30 minutes? No,
No, you
right?
don't.
They could be
No, you
doing
don't.
something else.
Well, Dr. Young, my teacher, he proposed a theory that there's 50 cycles of qi in a day that are constantly moving, and that there's 1,440 minutes in a day. And he did some simple math: 50 cycles of qi divided by 1,440, you get 28.8 minutes. Okay. Now, if you look back at the acupuncture classics, you're thinking, well, how quick is the response in acupuncture? And I would have to say it's faster than it's as fast as insertion. You really don't have to lie down for the half hour. If you get the response, you can just keep a patient on the bed, maybe 2 minutes, 3 minutes, 5 minutes, and then kick them out. All right. That's one way of doing it. But I think most people like the warmth. They like the comfort. They like lying in bed. They like talking to a practitioner. They like listening to the music. They like the heat lamps on them. They like being attended to.
Yeah.
Okay, so there's the white lab coat. They like that too. And so, if that all stacks in my favor for a more favorable healing response, sure, why not? I'll do it.
Yeah. Yeah.
And I think that's what it is. But in the reality is, it can be as quick as upon insertion, and then there's an effect.
Yeah.
Now, of course, what is the mechanism of acupuncture? And if we talk about it from a Chinese medicine point of view, we're moving qi and blood. But most people are thinking, well, what is really the mechanism? So then they'll think, okay, I'll insert needles. This causes the inflammatory response. And then what the inflammatory response, what has to happen is, monoamines and platelets and white blood cells move to the area, and then endorphins are released, and so on and so forth. Okay. But it's actually quite simple. Acupuncture is wounding the body to induce healing. And that's the real mechanism. So as fast as it takes me to wound your body with a
Yeah.
micropuncture of a needle that heals instantaneously or very close to it, then we will get a healing response. But then because it heals so quickly, we have to do it again. So most people underdose the acupuncture. Every medicine has its dosage. So let's say I have a headache and I take Tylenol. I have to take 2 Tylenol every 6 hours. Well, if I don't take like the seventh or eighth hour and it doesn't work, I can't say, "Hey, Tylenol, it doesn't work." Well, it's not true. I have to take another dosage of it, right? The same thing with acupuncture. Acupuncture should be taken 2 to 3 times a week. It should not be taken, just once a week, or,
Yeah.
once every 10 days or once every 2 weeks or something like that. People are grossly misdosing acupuncture.
Yeah.
Right.
So the frequency matters to keep that
Yes,
response in the body, to
that's
stack,
correct.
in a sense, also for the healing. And then
Exactly.
how would you go about incorporating herbal medicine into these treatments as well? Would you incorporate herbal medicine depending on the situation, or how do you combine these different modalities?
I do. I consider it as how can we say, homework for the
Mm.
patient. For example, today I saw a patient with acute back pain. She's a caretaker, injured her back, taking care of her patient, and she couldn't move her back. When she stands up, she has a great deal of pain, maybe a six to 7 out of 10.
Mm.
So I gave her a topical spray to put on and rub on 3 times a day, and then I gave her herbs, common formula, distal, vowed, right? Trauma pills. And I said, okay, you're going to take these 2 bottles. You're going to take 12 pills 3 times a day. This is your homework, okay? And I want you to soak in a hot tub tonight with 2 cups of Epsom salt, just stay in there for about 20 minutes, and then, get a slight sweat, and then get yourself out. And then, you make sure you take your medicine, make sure you put on the topical spray, and then I'll see you next Monday. Okay. Today's Thursday. By next Monday, she should be able to tell me if she's gotten better. If she followed my instructions, she should get better. And, it's a good way to remind the patient, hey, I've got to do something for myself. I'm part of this. I'm part of this treatment plan. I have to do my work, my homework. And so herbs, topical and internal, is the best part of it, where they are helping themselves in between visits.
Out of curiosity, because I know this is an area of expertise for you, when you give topicals like the Jiao or what, do you make them yourself, or do you buy a patent already made?
I don't buy patents because mine is probably the best. I've had a long time of trial and error. I was given a formula probably when I was about 15 or 16, and then started making it. I followed the recipe exactly for the first few years. Then I realized, hey, I'm getting a rash when I'm using this. What's going on? So over time, I talked to different practitioners. Oh, you're getting a rash. Maybe this formula is too hot. Take out this peppercorns out of this formula. Take out this herb. Maybe this herb is too hot for you. All right. And then I had to modify for myself. And as I kept modifying, it was like, well, in Wing Chun, we get a lot of chest trauma because we hit the chest in practice. And so we have bruises there. Maybe rubbing it in, it helps, but maybe not fast enough. So maybe add a guiding herb to the chest. Tan xiang, right, is one of the famous herbs for guiding. And so when you're guiding it to the chest, it heals that area faster. Or maybe raw versions of a certain herbal. Okay. Let's say ban sha, or, well, there's chuan wu, cao wu, right? These are all, you can use raw herbs for topicals. You can't use them to take them internally, but you can use them for topicals. Okay. And so maybe these are better ways of strengthening the formula. So it got modified over the years, many, many times. And so after about 40 something years, I perfected this recipe, and it has very, very, very good results. In fact, several acupuncture clinics are carrying my line of distal spray. Yeah. And they're using it. They're saying, oh, it works really good, and it has a very quick response. And in fact, because I use it as a spray, I put it in a spray bottle. They're using it for what? Insect bites, like mosquitoes or ticks. Okay. Now on the East Coast, when people have, they can get bites, they can get EEE, Eastern equine encephalitis. They can get Zika virus. They can get Lyme's disease. They can get ticks, with other types of issues. So they spray it on, and then they don't have any problems. Right? It stops the itching, stops the pain. For bee stings, it can work. For spider bites, it can work. So it has a lot more application and usage rather than just what it was originally for bone bruising or contusions. And it's amazing finding out every day. And I've made it so that it doesn't smell as hard. When I first got it, it's like, this smells terrible, right? But now over the years, I modified it with aromatics to open up the orifices and then stop pain, and it feels more minty and smells better, and it works better. So, yeah.
Similar to the idea of allowing the patient to lay on the table to relax their body and give them nice treatment, making sure that the herbs smell nice as well when they're using them.
Definitely. It's just like giving herbs in pill form or tablet form or capsule form, rather than making a raw tea from raw herbs where they have to cook it for half hour, 40 minutes, and then stink up the whole house, or they don't know how to cook in the first place, and they burn the herbs or ruin it, and it tastes hard. And I remember when my mom had to chase me around the house, said, okay, this is time for your medicine. It's like, oh, Mom, this is the worst thing. I don't want to take it at all. If I couldn't take it, right, why would I do that to my patients? So I did it so that it was they could be more compliant.
Yeah, certainly under ideal conditions, we know that decoction is an amazing way to take the herbs, but it's rare to find the patient that is able to prepare them correctly and willing to consume them. And
That's true. That's true.
so now, in addition, as we unfortunately have to wind up pretty soon, you practice with the Master Tung system. You prescribe both topicals and internals. Lastly, I was just wondering, do you find the time and are you able to? I know this is something that you're passionate about, but can you educate your patients on movement and exercise? Do you ever teach them some martial art exercises or Tai Chi or the Bagua system? How do you inspire? Because you certainly do all these things yourself. How do you inspire or teach your patients to incorporate some of these additional modalities into their life?
Thank you. Thank you. Prior to COVID, before we went on, isolation lockdown, I was teaching a qigong class to cancer patients and to Parkinson's patients as well, and was teaching them basic qigong exercises that I designed a set of, taking many classical sets and then breaking them down and then putting them into the division of, okay, this exercise is for the neck, and this one's for the shoulder, and this one's for the elbow, this one's for the wrist, and this one's for the fingers, and this one's for the waist, and this is for the knees and hips, and lastly the ankles and feet, right? And then we promoted different meditation and relaxation. And so let's say that was one thing. We'd have a class that met at least once or twice a week, and we did that. I haven't done it since COVID was lifted, and it's been several years now, but I did that for 18 years.
Oh, wow.
Weekly. That was a great commitment. So I don't do it much anymore, but I'm still willing to teach it. I might have a class that I'm going to put up to do a follow along, and maybe people who want to subscribe to that, they could do that.
Yeah, it sounds like the time is ripe for an online video class.
Definitely, I think so. And then I'm working with a hand therapist. I broke this middle finger of mine a few years ago, helping my son move to his dorm. And I realized that I had to do some PT. So stretching it, using Tuina to stretch the finger helped me. But aside that, I would do different gripping exercises. Now, if you're seeing my gripping exercise, so I'm doing the leopard paw here, and then I'm doing the tiger claw here, and then I'm doing the crane beak here. So I do this and this. So flexion and extension, flexion and extension. And I taught that to several patients who had tendinitis, arthritis, rheumatoid arthritis, or injury to their hand.
Yeah.
And so these are, of course, martial arts exercises. They can be included in the practice as well. So
yeah, simple things that anybody could incorporate.
Definitely.
Fairly easy with just a bit of guidance or
Yes,
a
exactly.
video.
And that is within our scope of practice.
Yeah.
So, definitely.
I have two questions that I often ask at the end of these podcasts. So if you wouldn't mind, I was wondering, what do you do to stay healthy in your life? I know you've mentioned a lot of modalities here. Do you practice them all on yourself? You continue, I've known you for so long, and you continue to take good care of yourself and look so young. What are your secrets that you employ with yourself?
I think eating is the most important thing. And so I became gluten-free about 6-7 years ago. I couldn't tolerate eating a cupcake or a bagel or anything like that. And I didn't understand why I was having bloating and upset stomach. It felt like someone was stabbing me in the stomach, and I'd feel like this terrible pain, and I didn't understand it. So my daughter said, "Dad, I think you might be, gluten intolerant." So I cut it out of my diet. And then I realized, wow, I lost a lot of weight. And I realized that I wanted to start eating smaller meals. So mostly vegetables, and then flavored with some meat. Not a big piece of meat and then a lot of vegetables, but it was some sort of vegetables, sauteed or steamed, or, let's say a salad, and then eating flavored with meat. And that would be my staple. And then avoiding eating too full. Chinese medicine and Ayurveda often talk about eating 2/3 full. I had no idea what 2/3 full meant. No one does. But then I was reading the Ayurvedic classics, And they said that the stomach can hold 3 anjali. And I was thinking, what is an anjali? I have no, is it a measure of weight or what? But actually, the secret is before you. You know how we say that the heart is about the size of your fist? Okay. Well, an anjali is 3 of these. You cup yourself, your 2 hands like this, like a bowl. Okay. And that's 1 anjali.
Oh,
And then you have the same equivalent anjali of broth, a soup, or tea. And that's 2/3. And
okay.
then the third is empty because your stomach needs room to churn. Okay, so that's 2/3 full. You understand? All right, and the people don't realize that secret is like, what? It's not a secret, but it is a secret because how big is your stomach? You don't know how big your stomach
Right.
can fit, right? So, uh, I thought that's very important. So I would have to say that eating is 80% of your health, and then the next 20% is just exercise and movement. And exercise and movement, you do different things daily. So, for example, I stretch, I do some yoga or meditation or some martial arts exercises, and then I might do some weight training. At my age, I need to do some weight training, so I'll do kettlebells. So I'm a minimalist. I might do 2 or 3 exercises with kettlebells. I'll do, descending ladder 8, 6, 4, 2 repetitions or 3 sets of 5, and then that's it. I won't try to kill myself with, okay, I need to do 100 push-ups. I need to do, 1,000 sit-ups and things like that. I don't want to do anything like that. I just want to just get some movement done. Or I'll make sure at lunchtime I'll walk a half hour, or, I'll stretch on 3 different planes, 4 different planes, because if we sit too long, we're sitting only in one plane. We don't move enough. So we don't rotate. We don't bend at angles, things like that.
Yeah.
I think that's really what you do. And then the biggest important thing in life is don't have too much emotions, too much strong emotions. Just try to be balanced. Everything goes back to balance. Just let things go. If it comes, it comes. If it goes, it goes. Let it go. If it comes, then welcome it, right? And I think sometimes you have to be that way, even though you don't want to be that way. You have to be that way. You have to learn, and then it's one of the better things in life that you have to do for yourself. What we say in Chinese, 不要烦恼, is don't upset the mind. Don't upset the brain where you become obsessive, or you're thinking too much, or every day spend some time laughing. Laughing is the most important thing. You can listen to music, that would do great too, but all of those would be fantastic, right?
I love that. That brings us back full circle to where we started at the beginning, talking about the emotions and the mental and spiritual aspects of not only this medicine, but our health. So thank you for telling us about how you incorporate that in your life. Lastly, is there anything that you'd like to share with our listeners? Something unrelated to the medicine entirely, but any interesting fact about yourself or something you'd like people to know about yourself?
That's a fun one. I say describe yourself on what you do on a daily basis. And I describe it poorly as I stab people multiple times a day, and then they thank me because they feel better and pay me. So I would have to say, but I see the humor in it, and if you look at things from the humorous side, that's very good. I would have to make a joke about East Asian parents. They're very, how can we say, very ambitious for their children. So there's only 5 Chinese professions. First one is doctor, second one is lawyer, third one is engineer, fourth one is business person, and then the last one is failure to the family or disgrace of the family. And I often joke about it, say, well, I'm neither of the first 4, so I have to be that one. But I guess we could fit in the doctor category and business person category, so not too bad.
You have made a good success of your life, and I'm sure your parents would ultimately be very proud.
Thank you so much.
If our listeners are interested in learning more about you, or purchasing your books, or visiting your clinic, or taking CEUs, where can they find out about you?
They can contact me directly at my email, chusauli@gmail.com. or usually they can reach me, through Google on the Google Maps in Pasadena. That's my clinic there. As for my books, they're all available on Amazon.com. All you have to do is do a search for Robert Chu Acupuncture, and then they'll all be there. I do have 7 titles in English on Master Tung's acupuncture. I have a book on 6 Healing Sounds Qigong that I co-authored with Hendrik Santo for the 6 Healing Sounds Qigong, which is a very fun practice. And then there's a book called Complete Wing Chun, back when I had hair and a young man and very enthusiastic, talking about the history of Wing Chun that I co-authored with 2 other authors. And then there are French versions of my Master Tung Acupuncture Primer and my Master Tung's Acupuncture for Pain. So that's something that's available. That one's in French. It's probably going to get released in Spanish and other languages as well. Yeah, so.
And you do teach some CEUs as well.
I do. I'm on eLotus, and I've been teaching at Emperor's College and different locations, and I'm regularly traveling.
Okay. Well, I think people can start out by watching your CEUs and getting some books. And if they're in California, maybe visiting you personally. So I just want to thank you so much for being my interviewee today on our podcast. It was a joy to speak with you and to see you here. And thank you very much for not only being my teacher, but for sharing this information today with all of our listeners.
Thank you, Gretchen. Thank you for having me.
Thank you very much.
Thank you.
All right. Take care. That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about Elevated Practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.